What started as an epidemic limited to the city of Wuhan in China has now become a devastating global pandemic. Up to date, there is a total of about 3.9 million cases around the world with around 270,000 deaths. As countries and cities around the world continue to suspend work and classes, observe social distancing, and encourage self-isolation policies, one question is likely on everyone's mind. When will this pandemic actually end? You'll be surprised to find out how simple the solution to all of this is. Welcome to Fact Closet, where you'll learn about the best and most interesting topics on YouTube. In this video, we're going to find out what needs to happen for this quarantine to end. We have gathered information from infectious disease specialists and researchers around the world to help put this global health situation into perspective. First, let us be clear on how this global pandemic started. Professor Stephen Turner, head of the Department of Microbiology at Melbourne's Monash University, cleared some of the misconceptions about the origin of this virus. According to him, there are still several aspects of the COVID-19 origin story that scientists are trying hard to uncover, including which species passed it to humans. Most likely, the virus originated in bats, but this doesn't mean that bats were the ones that transmitted the virus to humans. If we would try to recall, there was news that a tiger in a New York zoo was infected with the virus. Not only does this show how it can move around between species, but also increases the probability that the virus came from bats, but was first passed through an intermediary animal in the same way that another coronavirus, the 2002 SARS outbreak, moved from horse bats to cat-like civets before infecting humans. The origin of the virus is still not definite, but now that scientists have broader knowledge of the coronavirus in other species, this gives them hints about its evolution and how it was able to spread so quickly, jumping from one species to another. They're trying their best in figuring out because knowing how a pandemic starts is the key to stopping the next one. What will you feel if you become infected? You might be very familiar with the signs and symptoms, since you've probably seen them flashing on your television screens every day. But to better understand these, let us trace the journey of the coronavirus the moment it enters your body. Once you've breathed it in, the virus quickly travels to the back of your throat and nose. The lining of the nose and throat is called the mucosa, and this is where they attach themselves to before they start getting to work. When it reaches to the back of your nose, the COVID-19 virus will take over your nasal passageway cells. It will get inside them and reprogram them to stop doing whatever job they were doing and focus only on making more COVID-19 viruses. Once that cell has produced more viruses than it can hold, the virus will burst out and attach themselves to neighboring cells, using them to reproduce, and then the cycle repeats itself. This destruction of cells in your nose and throat leads to dry cough and sore throat. The pain you feel is the sign that your cells are in distress and are being destroyed. Here comes the next part, the fever. By this time, your immune system has realized there is a foreign body inside you. It has taken until now for this to happen, because when a new foreign body enters the body, it takes time for your immune system to recognize it and start the immune response. Chemicals called pyrogens are released by the immune system. These instruct your brain to raise your temperature, giving you a high fever of 37.8 Celsius or higher. This temperature helps your body trigger other parts of your immune system to start working and also creates a hostile environment for the virus. But because since they tend to make us feel unwell, we try to bring them down. The fever, cough, and possible sore throat are where the symptoms will end for most people. Within 5 to 7 days, your immune system will have responded enough to now be able to destroy the virus, and you will recover. But what about the complications? Why do some people die because of this? Some people have immune systems that will not be able to respond as quickly towards the virus, so it will continue to spread. These are people who are immunocompromised or have underlying health conditions. As the virus duplicates and infects more cells in these people's bodies, it works its way down the airways towards the lungs. This is the scary part. It invades the cells in the lungs, making it hard for the lungs to do their job of taking in oxygen and removing carbon dioxide. Therefore, your lungs end up working harder and you will feel shortness of breath. You may have heard of patients saying that they've experienced breathing difficulties. This is because the cells responsible for our breathing functions are impaired. People will feel their chest tightening. They are unable to get out of bed as the body needs to conserve energy. and general aches and pains take hold as the body diverts all energy resources to fighting the infection. As the COVID-19 virus attacks more and more parts of the lungs, they become inflamed and can start to fill with fluid and pus. You then have pneumonia. If the lungs swell further and fill more with fluid, a patient may need a ventilator, and the risk of death enters if the lungs give up altogether. Some people have reported diarrhea as one of their symptoms. This is possible because the COVID-19 virus may be able to get from your nasal passageways and travel as far as your gut, causing problems there too. The possibility of transmitting the virus through feces is still being studied by scientists. If you have survived the disease, like recovering with mild to moderate symptoms, then you will build an immunity to COVID-19. Since the situation is currently evolving, what can we expect to happen in the next few months? Dr. Sandra Kesh, an infectious disease specialist and deputy medical director at WestMed Medical Group in Purchase, New York, said that since this is a new virus, those who have not been infected, which is a vast majority of the world, have no immunity to it. Don't be surprised if events continue to get postponed or canceled as we move deeper into the spring and summer, and expect to stay inside. Outings and activities will still be limited until the end of May or longer. No one can say for certain, and it depends on where you live. The more people who stick to the rules in their area, the better off we'll all be. Staying home and taking other distancing measures are important ways of slowing down the spread of the virus and buying time until treatments are discovered. This brings us to the most awaited question. When will this quarantine end? We need to starve the virus. The answer is not just having an effective vaccine available, but also continuing to practice social distancing. Yep, you heard that right. Here, let me explain why. At the moment, over 80 COVID-19 vaccine trials are currently being done. If one or more of the vaccines eventually make it to the market, how should it be used to stop or even eradicate the virus? Vaccination has always been used in mass programs to create herd immunity in the population. A huge number of the population is vaccinated, so that even if they'll be in contact with infectious people, they won't be sick and won't infect more people. However, vaccinating everyone is neither practical nor feasible. That would take a very long time and a large amount of money. What should we do then? Mathematical modeling and data from vaccination programs suggest that we don't need to vaccinate everybody. If we protect a large enough proportion of the population, we can effectively starve the pathogen of the supply of new hosts. Scientists believe that for the novel coronavirus to stop spreading and to slowly die out, about 50% to 70% of the population needs to be resistant for the virus. An even higher proportion is needed if we want the eradication to proceed quicker and to prevent further outbreaks. Instead of vaccinating millions of people, the vaccination program can be combined with testing and isolation to limit the vaccine's application to only a specific location. Restricting movement through social distancing can be used to stop people from spreading the virus outside. The vaccine program could target those at high risk because of their occupation. For example, health or care home workers and their families. Vaccinations could also be offered to those who are at risk because of their age or existing health conditions. If a large number of the population is already immune and only a few cases remain, then the quarantine could end. But we also have to understand that total eradication is impossible. History shows that it is incredibly difficult to eradicate a virus globally. It has only been achieved twice for major diseases of humans and animals. The smallpox vaccine was first developed and used in the 1700s, but the mass campaign to eradicate the virus stretched throughout the 20th century. The number of cases was reduced as each outbreak was isolated, and those living close were vaccinated. After a very long time, smallpox was officially eradicated in 1980. That was more than 2 centuries after a vaccine was developed. The difficulties in delivering a vaccine in remote war and poverty-afflicted parts of the world contribute to the long period between the campaign's success in developed countries and the final complete success. Even if we manage to eradicate the novel coronavirus in first world countries, there is likely to be a long period before it disappears entirely from the world. In such a case, health workers and travelers will need to continue to be vaccinated on demand. Since there is no available vaccine while we wait, we should start to plan on how it can be used in the most cost-effective and publicly acceptable way. We need to know how to balance the demand for herd immunity with the protection of individual rights. This requires the efforts of public health experts, doctors, psychologists, and political scientists together with mathematical modelers, basically everyone. We all have a part to play in this battle. Even by just staying home is already a great contribution. That's it, guys. You just found out what should happen for this quarantine to end. What do you think about the solution? Let us know below. If you liked the video, let us know by dropping a comment or hitting the like and subscribe button. Also, turn on your bell notifications so you don't miss out on our future videos. See you next time.